Welcome to the Dr. Berkson's Best Health Radio Show. We're in the middle of COVID. I go swimming every night now because I can't go into the gym, so I go to the quarry lake behind the gym. So I've got COVID here, but I'm here to give you some agile thinking. And I know one of the big questions that we all love to seek out are natural answers and how we get to the root cause of illness to put illness in our rearview mirror. So I have been lecturing and having some podcasts on how oral contraceptives are actually endocrine disruptors. In fact, when I was a scholar at Tulane at the Center for Bioenvironmental Research, we would often use ethinyl estradiol, which is one of the estrogens used in oral contraceptives, as a control. If we want to see if plastics or volatile organic pollutants or some pollutant assaulted your hormones. We knew that ethinyl estradiol does, so we would compare it to that. That's what meaning using it as a control. So everyone then says, well, if you can't use birth control pills, if they're not that good for you, what are the alternatives? Mm-hmm. And I haven't really known that answer. On today's show, we have an amazing doctor. She is an internist, and the internists are the thinkers of medicine. Mm-hmm. She is a pediatrician. She's double board certified. Pediatricians are the smart plus heart in medicine. So she had an epiphany about 2013 with her own story that led her to come up with a brand new technology based on someone else's work, which we're going to hear all about, giving us natural answers for birth control as well as real solutions, medical solutions to problems like, and I'm going to give the list that she lists on her website. Her name is Dr. Susan Caldwell, by the way, and you wouldn't even believe that she has as many children and as old as they are because she looks young and adorable. But the real solutions that we're going to be also mentioning downstream are infertility, menstrual cramps, PMS, ovarian cysts, irregular bleeding, abnormal bleeding, polycystic ovarian syndrome, repetitive miscarriage, postpartum depression, prematurity prevention, hormonal abnormalities, chronic discharges, and other health issues. So the big deal is that, and then I want to bring her right on the show before I talk too much more, is that regular medicine has been failing women. Mm-hmm. And women are pushed to contraception, and gynecologists hand out oral contraceptives like M&Ms. So we need to look for body, mind, spirit, whole body, natural answers. And now we have Dr. Susan Caldwell on this show. I'm excited about this show to help share with us what her clinic in New Orleans is doing for these natural answers. So welcome to the show, Dr. Caldwell.
It is great to be here. Thank you so much just for your openness. And I think that one of the marks of just a good practitioner of medicine is to be always learning, always willing to share knowledge and to receive knowledge so that we can help our patients have the best health possible. So thank you for being one of those people.
Thank you. That's the reason she's saying that is that she sent me an email because she listened to the show that Dr. Felice Gersh and I did on birth control. I'm not going to read you the whole thing, but she sent me this email where she said, Dr. Berkson, I started listening to your podcast this week after a physician friend of mine recommended it to me. And then she said, I'm excited, but you said that you didn't really have natural answers for birth control, and we do. And she then led me to all these links, and she recommended somebody else. But I said, no, I want you, because her note was so passionate and informative. And I honestly didn't understand, though, the natural answer. So she's on this show because she reached out because she cared so much. So it's a win-win. And she said before we started the show, she said, I know we're just natural soul sisters. I love that.
I know that. I know that for sure.
So tell us what are these natural answers, and then we'll get later into how you got into that yourself. Most people get to their own journey, but what are we talking about?
Right. Well, so at some point, I think many doctors come to realize that birth control just doesn't really solve the problems that they're promising to solve, right? So I stumbled upon a whole bunch of research done by primarily Dr. Thomas Hilgers out of Omaha with kind of this way I had always struggled with a way to, plan my family in the past and treat medical conditions myself. And I was just given this kind of one size fits all of either birth control or IVF type of thing. And that's what my patients were seeing. But there's just so more options, right? There's more options, right? So if you're trying to plan your family, if you're trying to treat medical conditions, we need to go back to the beginning. We need to learn, each woman deserves to learn how her body works. Instead of being given a technology, whether it's a pill or a procedure that would manipulate or control her body, how about giving the woman the information, the knowledge to make decisions about her body? So what I'm talking about are natural methods of fertility awareness. The old kind of term for this would be natural family planning, but it's so much bigger than that and deeper than that. It's basically about giving a woman the understanding of how her body works, and then the tools to help to restore health if that health is distorted, or to just to understand how her body works so that she won't have to take all these endocrine disruptors. So she doesn't have to undergo these really expensive procedures that really in the end don't solve anything.
So let's say that I'm going off to college and I just got accepted into Harvard, and it's been a lifelong journey to do that. And I'm going to be maybe sexually active. And so I want to take birth control because I don't want to. And this was actually the physician I work with in Naples. This is what she was faced with when she was a young woman starting in her medical career. So she was in a relationship, but she didn't want to get pregnant. So what do you recommend for birth control? How does someone use knowing their body better, and how does that protect them from pregnancy?
That's great. But I think that question that woman has really comes almost too late. Okay. So what I mean by that is by the time a woman is sexually active, sometimes it's very difficult because now if you're and not that sex is in any way bad or harmful, but what we really want to do ideally is to start when a woman gets her period at 12 or 13. With the women who are shaping and forming her, right? So our goals for our little girls are, to be very smart, to choose well in the areas of love and life and health and education. But we need to give women an education in their bodies at the same time as we're giving them education in physics, in calculus, and those kinds of things. So what we see is that when girls are taught by their moms early, I don't want to get too far off into this because, but this is a great question that you just brought up.
It's the most common question I get every single where I go. So I am going to want you to address the woman that's 19 and 20.
Oh, no, we will.
Okay, great.
Absolutely,
but this is so fascinating what you're saying. I love it.
Yes. So what we need to for example, my daughter, had her period when she was 12, and we kind of threw a period party. This was very exciting. This is a big deal for her. We wanted to affirm this beautiful piece of her femininity that was there. And then as she matured and had the understanding and questions, right, about her body, we started talking about, okay, so this is what's happening. You're having this period. There might be a little bit irregular. Just having these conversations that generally I don't think are being had in pediatricians' offices and at home with mom or sisters. And then a woman starts to realize the wonder of cervical mucus. Okay. Cervical mucus is this lovely substance made by our cervix every month that it's the consistency of like an egg white consistency. And most women are just taught that that's gross and yucky, and we just don't need to talk about that. Okay. But in preparation for the glory of sex and intercourse and all that comes with that, a woman needs to understand that cervical mucus that's present for about 5 to 8 days a month is the super highway okay, where the sperm has access to that egg that is there once a month that only lasts 12 to 24 hours. Okay. So by starting to have that conversation.
The cervical mucus only lasts what?
No, the cervical mucus is present. It's for 5 to 7 days a month. It's a reflection of that estradiol being made by that follicle as it matures towards ovulation. A woman will notice increasing kind of this quality, the fertile quality of this mucus. It becomes from white and kind of sticky. It becomes very clear, stretchy, and watery. And with that, a woman.
And what was the thing that was only 24 hours?
I'm sorry, the egg.
Oh, the egg. Okay.
It sits in that fallopian tube and it waits for the sperm, and it only can live 12 to 24 hours.
Okay. Gotcha.
And it's only released once a month. Right. So in terms of birth control, we need to question why we would take an endocrine disruptor carcinogen for 24/7. I took it for 10 years for something to prevent something that's only going to happen once a month. And we just have to think about the rationale. So that's kind of silly, right? So if once a woman, I'm talking about a gentle explanation as a woman is ready. I'm not telling anybody to sit down when the girl is 12 and tell her all of this, okay? But to have an appreciation. So you and Dr. Gersh so beautifully spoke about how important it is that we kind of understand and then share with our children the inseparable quality, if you will, the idea of sex and babies. It's inseparable, and we can do anything. We can take pills, patches, shots, rings, implants. I'm trying to think of all the things they have now. We can give all of this to our teen daughters and say, good luck, right? But even in the best of circumstances, if our goal is to prevent pregnancy in our teen daughters, it might work, it might not. Are they going to take the pill? Probably not. They're going to forget, right? So we just I just don't think we really get, as women who are, in my case, I'm responsible for these girls as their doctor, but for women who are responsible for their daughters or what have you, it's not as simple as, handing their, I'm thinking of one male OBGYN who told his nurse to hand his daughter a pack of pills before she went to college in a brown paper bag. And that's it. That's what she got. Okay. So basically what we're telling our girls is that, you can't control yourself, and I don't know what's in that pill. Maybe I know it's a carcinogen, maybe I don't, but I don't know what's going to happen. And we're just going to cross our fingers and hope that you make good choices. Well, as you know, a girl can be very smart when it comes to, their studies. But if they're not smart in the ways of their heart, their emotions, how they relate to other people, they can get into big trouble with sexually transmitted diseases, with, as you pointed out so beautifully in your podcast about birth control, it kind of disrupts our own ability to take control and understand our emotions. And we don't relate to people. Sometimes, this is another thing that scares me too. It actually changes the type of partner. When you're on the pill, it changes who you're attracted to. You're attracted to somebody.
This is so true. And there's so many replicated studies on this.
Yes.
That taking birth control pills makes you a different person and choose different people. And I think that part of the reason is because when the corpus luteum, that progesterone is released at the corpus luteum, but so is oxytocin. And if that's blocked, you block it, disrupts your own feel good with the world hormone. So when you don't feel as good, you make worse choices.
Yes. And then, as you know, that frontal cortex is not developed till our children's about 25.
Right. You don't have your head on straight till you're much of an old, you're out of your mid-20s.
Why are we even talking about sex when people are 19? I know, hey, look, I'm not going to tell you when I started, right? We're not going to go there, right? But, my kids, we talk about sex all the time since they were just tiny teens.
Like what kind of things do you talk about?
About what we're talking about at the dinner table. because they just don't know what they don't know. Right. And so you can get into a really bad situation. You can get emotionally and hormonally kind of locked in with someone who isn't good for you. If you're not using your adult brain, which, by the way, you don't have until you're 25. Now, we have to know, and I'm in no way am I Pollyanna, oh, my kids are just going to be perfect. Absolutely not. Kids make mistakes in all things, right? We all, because of that brain, right? But the last thing we want to do is encourage, right? And to say, oh, here's birth control, because I really just care that you get, all these degrees behind your name, and that you're very, golly, I took birth control for 10 years, got off of it, and I was infertile. Crickets were chirping, like I had shut down my body for 10 years to get this MD degree, which, whatever. My point is that I'm quite sure that the reason why I was infertile was because I was taking the birth control. So I think I guess I just would like to open the listeners' eyes to the possibility that, yes, we have some very practical questions to answer here, but our kids are much more precious. And they're not just little, robots that we're trying to get to make a lot of money and to achieve these things, but their relationships are just as important. Their bodies are just as important. So we don't want to sacrifice their health and sacrifice, all that comes with irresponsible sexual activity to get to, a certain degree, or we just want to help continue for example.
Wait, I just want to say one thing before you go to that, just as a comment before, because it's, I love what you were saying, the birth control, people don't realize it makes your brain different.
Yes.
And so I work in Naples at Dr. Perlmutter's old clinic, and he wrote The Grain Brain. Now his newest book is called Brainwash. And he says that part of the problem in the world, but especially the United States today, is that normally an adult functions from their higher executive cortical functioning. So you can think straight, but most people can't think straight. They now think from their reactive reptilian brain. And most parents aren't aware that the birth control pills and years on it is contributing partially to this epidemic of people who have triggered brains that don't have higher executive, as well as the pollutants. But birth control pills are big. That's why this show is so important.
Yes. So thank you.
I'm sorry. I just didn't mean to get you off track there, but.
Yes. Oh man, we just need to take a second and just take that in. So, while I just think we need to think bigger and sex needs to, I know everybody's scared to talk to their kids about sex. It's really, really scary because we have this belief that kids are going to do it anyway. And we just need to just hope for the best and keep them protected. Right. But what's protecting their hearts? What's protecting their bodies from these chemicals? So, I believe that with knowledge, starting when a child recognizes their fertility in terms of puberty, the changes of puberty, starting to talk about that. So with boys, my boys, they know what breasts are for. They know what breasts are meant for. They understand these desires that we have that are very unruly. They might have a desire to eat a whole pizza, and then we get a stomach ache. We just learn that we as we just grow, we have all these crazy ideas and crazy desires, and we can't act on every single one of them. And when we do, we're usually going to face the consequences, right? But anyway, knowing more about a woman's body, because a male's body is pretty simple, right, in terms of reproduction. 100% fertile, 100% of the time, generally. But a woman, we've got this beautiful symphony of hormones that can be really understood. And every woman deserves to at least have that information. And I think it needs to happen before, ideally, at least the seeds of it need to be planted before she starts in patterns of sexual behavior, whatever that looks like, healthy or unhealthy, because our reproduction and our hormones are so intimately connected to our ability to bear children, whether we want them or not. I mean, that's what those hormones are for. They're gearing up towards for us to be fertile and to be pregnant, whether or not we ever are. And that's important.
And of course, we're now seeing an unfolding job description for hormones because as we have reproductive activity, we have sexual activity, these hormones circulate the bloodstream and they help your brain, they help your mitochondria, they help your epigenetics. So this expanding. But so I love the way you speak. I love the way you speak. I'm so excited we're getting in on this conversation. So can you tell me how it is that you start teaching a young girl to identify this mucus? And then what do you do with an older woman who's had years where she didn't have a mother like you? She didn't have a mother who was your patient that was instructed and educated by you. So can you guide us a little bit how somebody becomes intimate with that?
So with girls, it depends so much on the child, because not all girls are ready. It really is a process of listening to them, and just like teaching a child anything, to read, to do different things. And again, the parents are the first educators there. So if the parents aren't educated, then they can't really. That's where I think a lot of us are getting in trouble, is because women like me, who I'm 48 and I was on the birth control pill, throughout. So we have a generation of women in my age group who are having children who don't know anything about their body, and therefore they can't, meaning their reproductive hormones, so they can't tell their daughters. So we're trying to change this. And I think people like you and me, I think we're going to be planning for the future. So ideally that would come from mom. But right now we're in a situation where that's difficult. So the girls that I see in my office are generally coming in with moms who have heard things about birth control, who are scared for their daughter about birth control. So they come into me because these periods are irregular or they're having cramps, and they come to me and we have this conversation and we start talking about it. But I'll be honest that most girls are not mature enough to do any type of formal charting until they are close to college age, and some even beyond that, because charting, which is paying attention, first of all being taught through a system that is there's multiple methods of charting that are very.
What are we charting?
Okay, we're charting signs of fertility. Okay, in general, this means mucus, cervical mucus. Okay, so different systems have different, if you will, kind of shorthands for what this means. That a girl would have a piece of paper, would maybe have stickers, and she would make comments every day regarding the signs of her fertility. So if we're thinking of a typical cycle, we're building this chart over a 1 month period, and think of this chart as almost like an EKG would be for a cardiologist, right? You can take one look at that EKG if you know what you're looking at and diagnose something. And know if you need to go to do a procedure or if you need to take a medicine. And that is kind of what we're talking about here. But not every woman needs to go to a doctor, right? But every woman should have a sense of whether or not her pattern of mucus and bleeding is normal or not. So generally how it happens, at least in my clinic, is people come to see me with something that is very wrong. They've got terrible PMS. They're bleeding too much, whatever it is, or they're infertile. And then this is somebody who has a problem, right? This is not somebody who's just charting their fertility. They would be sent to a teacher, a class, if you will, but generally it's a one-on-one type of thing. I'm talking about the Creighton model, fertility care system.
CREIGHTON, the Creighton model.
Creighton model. It was developed at Creighton University, which is in Omaha. That's where that name comes from. So a woman is taught over a couple of months how to pay attention to the patterns of her bleeding, the patterns of her mucus, and then very important, the most important thing we focus on really is the luteal phase. That time in the cycle, that very unique time where our bodies are flooded with this wonderful hormone, progesterone, right? Made by that corpus luteum in the ovary after ovulation.
That's why it's called luteal phase. It's made by the corpus luteum.
Yes. So we have these phases of the cycle. We have the period. We have that time where estrogen levels rise, causing the cervical mucus to appear, telling us that ovulation is coming. Then we have the luteal phase, which is from the time from ovulation to the next cycle, where the progesterone's made by the ovary, and so many benefits are happening there, all through our brain, our uterus, everything. It's just so many good things happening there. So we pay attention to the timing of these things in the chart, because the timing and the how much blood or how much mucus and so forth can tell us a lot about a woman's health. Right. Whether
so can you give us some examples, like a few things, some types of bleeding that suggest what?
Okay. So a woman who has very heavy bleeding, for example, very heavy bleeding, may have a luteal defect. So let's back up here. So we're talking about different levels of our hormonal communication, right? So we've got the brain that is trying to communicate with the ovary to tell the ovary to ovulate at that particular time. And by ovulating, we make these hormones, which are super important. I'm especially talking about progesterone, because estrogen's kind of on board almost every day of the cycle, but that progesterone is that unique hormone. So progesterone comes on board, and progesterone kind of, if you will, checks estrogen's work. So estrogen's job is to build up that lining, to be thick. Right. And progesterone comes on board and stops that estrogen from having the effect of continuing to build up the lining and to transform that lining into one that either gives us a healthy period, which is not too heavy, or a healthy pregnancy. So many women have trouble with infertility, especially after getting off the pill, because the pill does not give us a true period. It doesn't give us true progesterone, right? It's this fake progesterone, it's the fake estrogen, which doesn't allow the lining to evolve every cycle like it's supposed to. So what can happen is we get this stunted lining. So when a woman wants to stop the pill and get pregnant, it takes a while to recover those hormones that kind of help that lining to become healthy enough. So back to the original.
Just one other comment. Such a great explanation, because progesterone is like a calming hormone, an anti-inflammatory. It's a hormone that gives you more peace. P for progesterone, P for peace. It's a peaceful hormone. And a lot of young girls are suffering with an increased epidemic of anxiety and overwhelm. Part of that is being due to the birth control pills blocking the peaceful hormone production.
Mm-hmm. Mm-hmm. So many times when I see on the chart, we have a shorthand for for the amount of bleeding, and usually it's H for heavy, M for moderate, L for light. And I'll see a lot of times VH, which means very heavy.
Very heavy.
So, as you know, at close to menopause, in the premenopausal time period, a lot of women aren't ovulating, right? So they're not making progesterone.
Right. So they're bleeding like crazy.
Crazy. But the same thing happens.
And they often go to get a hysterectomy because the doctor says you're going to bleed to death. And when they're really progesterone insufficient, it's maddening. It's just maddening.
Yes. And Dr. Geraldine Pryor out of Canada has some wonderful protocols for heavy bleeding in different phases. So in the teen years or the premenopausal years, frequently we'll see this very heavy bleeding due to low progesterone. And generally they get their progesterone and they're sleeping better. It restores the hypothalamic pituitary ovarian axis, which are just that brain ovarian communication centers.
The body hormone crosstalk.
Everything. Yes.
My whole childhood, I had the heaviest periods. They were like the bane of my existence. For 2 weeks, I was anemic. No one ever tested my iron. I had terrible pain. My body was crying out for progesterone.
Yes.
I suffered for so many years of my life. And I went to gynecologists. I went to specialists. mucus. And if you look at the physiology and what you're saying is so starkly clear, it makes me so angry. I could grind my teeth to powder. And that's why this conversation is so critical to get out there, because women are still having all these symptoms and getting procedures or birth control pills, which aren't addressing the root cause. And on top of it, there's so many pollutants in the environment that also can act against progesterone. They're called anti-progestins. So we've got the birth control pills, and we've got plastics and volatile organic pollutants and different surfactants and flame retardants. So we are living in an environment that bangs against our hormones. So we have to learn how to naturally make them healthier, which is why we're talking to you.
Yes. So, really, I think it all boils down to if we pay attention to our body from the beginning of the story of our reproductive life.
Your kids are lucky to have had you and your patients, I got to tell you.
I don't know. But if we can learn how to tune into our body and not tell it to shut up, right? When things start to be off.
In the birth control pills, you mean tell it to shut up?
Yes, exactly.
Yes, okay.
Because basically, our bodies are crying out, I'm in pain or I'm having terrible bleeding. Well, these problems don't go away when you take the birth control pill for 10 plus years until you're ready to have a baby, right? We want to turn off the switch, turn it back on. When we turn the switch on and say, oh, wait, we want to have a baby, it doesn't work. Nobody knows how to look into it to see why. So we send everybody to the IVF clinic, right? Then that's a very expensive, not very effective technology. Really, when you look at all the numbers, and people they go through the process, whether or not they have a baby, nothing's been fixed.
They haven't gotten to the root cause of why you were having the problems in your teenage years or whatever those years are, or why did you have polycystic ovarian syndrome? Nobody's getting at the cause, which would make the rest of your life much better.
Right. And perimenopause and menopause, and no one knows the difference. Patients don't know the difference. Doctors don't know the difference between actual hormones, bioidentical type hormones versus these toxins and carcinogens that we call birth control and typical HRT, hormonal replacement therapy. So there's just so much that we have to learn, and we can't stop learning. We just can't.
And what's so ironic is right at the time that you are saying this, you are learning this, the veil is being pulled away to show us we need to get at root cause to protect our future generations and to have less suffering and to get rid of illness at the bottom of why it's caused. Now the FDA is going to try and take away bioidentical hormones. Right. So that's a whole nother conversation. We're having a big meeting on Friday because that's scary as heck. They only want to make it available as an FDA approved product, anyway. So how do you then, let's say, this is the most common thing. I was part of a 3-day conference last weekend for pharmacists and medical doctors on hormones. And I discussed xenoestrogens and how birth control pills were endocrine disruptors. And everyone said, what do we recommend for our teenage and 20-year-old patients? How do you take someone who didn't get that training from early on to understand her mucus and start using natural birth control, which I guess you're saying this is a natural birth control method.
Yes.
Okay.
So it's a way to either avoid pregnancy, achieve pregnancy, or to treat problems. Yeah. But, it involves knowing your body, which means learning. It's a skill.
So do women put their hands up there every day and look at what do they do? I don't know what you mean.
Yeah, good. Thank you. That let's go all the way back down to a simple, because this is written. Nobody knows this, right? So women go to the bathroom all day long, right? Yep. But men don't have to use paper all the time, which is I'm very jealous. But anyway. So when a woman goes to the restroom and she's charting, she's simply observing what is on the tissue. When she wipes front to back using flat folded. When
she urinates.
Urinates or defecates. Well, in the Creighton model, there's different methods that observe mucus. The Creighton model is the most, the PhD, right? We have like the bachelor's program, the master's program, and the PhD.
Uh-huh.
So the Creighton model, because it also dovetails with medical diagnosis and treatment, we want to observe every single observation. So we tell women to wipe and observe before every time they urinate, defecate, take a shower, swimming. You want to observe, because sometimes on fertile days, you might only have one. In a woman who's relatively dry, you might only have one observation.
Could you say exactly what you're observing when you wipe the toilet paper? What are you looking at?
You're looking at mucus. So when you wipe the toilet paper, when you wipe yourself front to back and look at the tissue before you toss it, you will see on there either blood when you're having a period, you will see nothing but urine or, whatever, just wetness. Okay, that doesn't count. You will see something that looks like another one type is almost like a glue, like you would get on the back of a credit card. Okay, that's a sign of an unhealthy discharge. You might see something that looks like hand lotion. That would be something that would be like an unhealthy discharge. But the discharge that we're looking for around ovulation would be looking like very watery, almost colorless, and actually very stretchy. Almost like an egg. If you dropped an egg on the floor, the white part of the egg that you can't really see too well, that's very slippery. Okay. And so in the Creighton model in particular, a woman is taught all the characteristics of the mucus. So she's taught, there's a whole, detailed shorthand system that she's taught. So it's very in depth. That's why I said the PhD system, because it's kind of a lot. So especially women who use Creighton, they need to have a high level of motivation. Okay.
So someone like at your clinic in New Orleans, someone comes in and you teach them all this.
Yeah, I don't teach them. There's a whole allied health profession of Creighton practitioners.
I see.
These are people who go through a 2-year, almost like you would go to do any allied health profession that takes about 1 to 2 years to learn. These practitioners have done that.
And you went through this too.
I went through the medical consultant portion, but as a patient, I did, of course, right. To learn how to do this for myself, I had to learn. And so what we find is people who are not motivated, you can't force, just like you can't force somebody to learn how to drive if they don't want to learn how to drive. You can't force someone to care about their fertility if they don't care, right? And that's just how it is. And we have to respect everyone's freedom. But generally, by the time people come to me, they are completely frustrated with birth control. They are at the end of their rope with IVF. They're at the end of their rope, many of them. And then at the end of this learning process, just like me, I wanted to kick myself. Like, why? Of course, it wasn't my fault, but I was just mad that no one had taught me about my body. And that I had, been kind of, I felt like I had all these years for birth control and in vitro fertilization and was never helped to be healthy.
So how long does this process take? And so a woman to learn this alternative to oral contraceptives needs to go to some kind of a practitioner that's been trained to help them develop a sensitive relationship to their own fertility pattern.
Yes.
And how long does that take? And what does that look like if someone wants to get that?
So it depends on the method. So I would recommend there's a website that's very good about breaking this down called factsaboutfertility.com. Wait, hold on. I guess we can put it in the show notes.
Okay, we'll put it. So you have to send me that link, and I'll put it in the show notes.
I'll send you a couple of links. And there's different methods. There's so many. And now we have this whole, kind of this femtech industry now, where there's lots of this information out there, but it's very important though, if a woman is going to use this to effectively prevent pregnancy. So there are people who use these methods who just want to know about their body. That's ideal. Then at some point, sex would become part of the picture. So then not only is a woman trying to just learn, hey, am I healthy? Am I having regular cycles? But also now there's an additional concern would be, wow, either I really want to have a baby, or I really don't want to have a baby. So these people are very motivated to use these methods, and they need to be used effectively. So just like anything that we would learn to do, cooking, driving, there are rules if you want to do it well, right? So if you want to be good at preventing pregnancy, then you need to make sure that you understand the do's and don'ts and use those. So these methods have an effectiveness that is as good or higher than birth control.
So what are the do's and don'ts?
So remember I said that there's some things we have to pay attention to. We have to know when we're fertile, right? So in order to do that, you can't check your mucus once a week. So you have to be observant.
So you're getting into the habit of every time you release something, you're checking it out for just a second.
Yes.
And you develop a habit, like you develop the habit of pulling the tissue paper off the precious pandemic tissue paper roll, that you look at it and you just get a comfy, regular relationship with is mucus coming out of you or not?
Yes.
And when?
And this is honestly, most women do not even have a clue. They're not looking at that. That would be weird. They're taught that's gross. Maybe you haven't, and you wouldn't believe the women who come in to see me, and they think they have infections. And they might have and this is where I'll just say a little caveat about these natural methods. There are women who experience unusual mucus every single day of their cycle.
And why is that?
There can be something called a cervical eversion. That is the way the cervix, when a doctor does a pap smear and they examine the cervix that is visible, that part of the cervix can be lined with the cells that are supposed to make mucus are supposed to be inside.
But they're outside.
Yes, they're supposed to be inside this little hidden canal or tunnel in the cervix. But instead, those cells that make mucus are right there in the vagina on the cervix. Well, they don't like to live there. So they make all this mucus, and it's very confusing. Now, in methods such as Creighton, our teachers are very good at helping women to determine, even when they have a lot of mucus, what mucus is fertile and what mucus is not.
So they're mucus experts, entrepreneurs. Yes.
But then, doctors should be able to recognize this and treat that eversion. We treat it with silver nitrate. We to that area, and that area heals, and a woman can use a method very effectively at that point.
So I'm a DES daughter, and I didn't have the hood over the clitoris, which is kind of one of the signs that you were exposed in the womb to DES. But there is also cervical eversion. That's more common.
Interesting. I didn't know that.
And when I was very young, I had to be treated. The only thing that helped me was silver nitrate, and I didn't know why. And then I didn't find out that I was a DES daughter till I wrote Hormone Deception or later on and so forth. And I had other issues like breast cancer. But that just explained a big thing to me in my whole life right now, having this conversation with you. Oh, that my mind is just really expanded here. Yes.
So you know how that can happen, how a woman can have all this confusing discharge and continue to get antibiotics and different things for yeast infections.
Right.
The mucus is important, and we need to pay attention. And that also leads me to, when I sent you that email, I wanted to clarify that our modern methods of fertility awareness, this is not your grandmother's rhythm method.
Oh, yes. This is great. Please get into that.
Okay. So the old-fashioned rhythm method is a way of kind of guessing when a woman might be fertile that month. Okay. It's almost like predicting the weather. It's not very accurate, right? So these methods, most of them, especially the Creighton, the ones that deal with mucus, are able to give a day-by-day answer to the question of, is this a fertile day? Every day, a woman knows on that day, if she's paying attention to her observations, her mucus diligently, and not, I haven't looked since last week. Yeah, you have to really know and pay attention, and you'll know day by day. So this also, I just want to give another just a warning to women who are following their cycle on apps on their phone. Okay, so there's these apps which can be wonderful, but again, they are the same as the rhythm method. Many of them want to tell you when you're going to be fertile, but this is impossible. Okay,
this is so. What you're talking about, we hear more and more about the word mindfulness.
Yes.
And going within so that we can deal better with the without.
Yes.
And what is a beautiful thing you're saying, it's that if you want to avoid birth control pills and all of the potential hoopla and dangers and issues and on and on and on, and infertility potential problems down the road, you need to have a mucus mindfulness. You need to know your mucus. You need to do that. You need to hang out with your mucus. You need to be regular with your mucus. And so I guess you can't really say how long it would take a 22-year-old woman that's in college or postgraduate school or something to know this, but you have to wipe yourself anyway. So it's just learning to have another level of observation. But if you put some effort into this, does it sound like it takes like a month or 2 months to start getting the habits to do this? Or what would you say?
Yeah, we typically will tell women, especially in the Creighton model, to avoid intercourse for the first month of charting. Because if there are other fluids, arousal fluid, semen there, it can confuse a woman. She won't know what's her fluid and what's another type of influencing fluid. Okay, so that is a barrier for some people. But again, as wonderful as sex can be, delayed gratification, and we don't need to have it all the time. We need to kind of stop having this belief that we can only be happy when we're sexually available 24/7. We got to stop telling people that, and especially our daughters, because we can lose being respected. Anyway, a lot of things.
That's a whole. I want to bring you back on the show to talk about that.
That would be good.
Because I'm very upset with what. That's a whole nother conversation.
Okay, yeah, but we'll get there.
Okay, you're fabulous. I'm so appreciative that you reached out because it's a great conversation. Sorry, please keep going.
Yes. Okay, wait. Now, remind me what I was saying because I got so excited just for a second.
You were saying the fluid. If you get other fluids, it's hard to tell what's going on. So for a month, you abstain from sex to start learning about your own mucus without anything getting in the way.
Yes. So again, the motivation has to be there because most 20-year-olds are very concerned with so many. They're trying to, oh my gosh, the things that they're trying to become disciplined in at this time. It's amazing. They're trying to figure out what do I need to eat for my body? How much sleep do I need? How do I learn these difficult courses? So the woman has to have that motivation of, look, I don't want all these toxins. I want to learn this for my body. Just like the learning of proper nutrition, that's another example. If somebody who's realized they have a gluten intolerance, that's difficult. That's hard to, do maybe an elimination diet. But guess what? Loving ourselves is worth it. We are worth it.
I love that. That's great.
We are worth it. And that's what this is all about. We need to stop telling our bodies to shut up and they're too much. They're not too much. They're wonderful. We just don't appreciate them.
So if someone were to come to you, what does that journey look like? Someone calls your office, makes an appointment, comes in and says, I want an alternative. I want to get off the pill. So what happens? Do you have to have a waiting time for the month to get off the pill? Does the pill alter the mucus for so many months? Tell us, someone comes in, they're on the pill, they want to get off. What's their journey with you?
Yes. The reality is we have to allow for 1 year for the pill to completely stop harming the communication between what did you call it? Between the brain and the ovary.
The body hormone crosstalk.
Yeah, the crosstalk. So we got it. But the good news is that's the big picture. But the reality is the day the woman stops the pill, she can start charting.
So are you saying that if she gets a blood test of her hormones, they could be screwy for a year after you've been on the pill?
Yes. I typically would wait probably a couple months before I do any FSHs.
If you run it too soon, you're going to look like you have no hormones because your hormones were turned off. But the minute you go off the pill, you can start having mucus mindfulness.
Yes. And it's true that even women who are on the pill sometimes still ovulate because the pills these days have lowered the dosage over the years. And some women will observe mucus. When we get them charting, they're like, wait a second, I've seen this every month on the pill. So every woman's different. The pill
does that create any problem if they're ovulating while they're on the pill? Is that any special problem in and of itself?
The concern, and that's how the pill, the pill works in different ways. Like it makes a mucus plug. It thickens the mucus. So the mucus, hopefully the sperm cannot penetrate that mucus, right? Remember I told you the mucus forms that superhighway for the sperm. Well, when you're on the pill, especially the progestin, it clouds that mucus and plugs it up. So even if a woman is ovulating, the sperm will hopefully not be able to penetrate that mucus. Okay.
Gotcha.
But the other thing, because of the pill, the way it affects the lining does not grow. Right, the lining does not become healthy enough generally to support a pregnancy. So, even if there should be a conception, the idea would be that embryo would not, unfortunately, be able to survive because it would not be able to implant. So, those are the three ways that the birth control pill protects against pregnancy.
Okay,
yeah,
great.
So you have all those going on. So it's not just simply you don't ovulate. Some women ovulate but don't get pregnant because of those other effects going on. Yeah.
So when someone comes into your office, we're talking about the journey of someone coming in. What are they looking at?
Yes. So they're coming in, they've got a reason, right? They are mad. They are in pain. They are aggravated.
Or the woman that wants to have an alternative for birth control pills to avoid pregnancy.
To prevent. Yes.
Right.
Yes. So the journey, we have a conversation and I just affirm all of her frustration that she's probably had and tell her, yep, you're not the only one. Welcome to the club. And so let's get to know your body. Let's figure out who you really are because you don't know yourself on the pill, right? You're not who you really are supposed to be, right? So we just affirm all of that because we know that this journey that's a little difficult. So we want to give her a lot of motivation and affirmation on the journey. We connect her to a teacher, okay? A teacher who is well qualified, who might suit her personality. Have our people, in New Orleans that we'll send her to.
Do you have them in your office or do they go somewhere else?
There's generally some of them are independent. They work on their own. They meet at a business or a church or at their own home. Different ones meet at different places, and so we connect them with a teacher. And some are even online. So nowadays they have online, virtual teachers teaching.
So if they take this course online to learn about their relationship with their mucus in their bodies, about how much does that cost? About how much time does that take?
Yeah. So I can speak for the Creighton model because that's what I'm familiar with.
The PhD model.
Yes, I think so. Yes. And so generally there's 8.
So you recommend the therapists that are trained in the Creighton model. That's
now this is okay. So people who need the PhD, right, are people who have bigger, tougher problems to solve.
Okay.
So these are not necessarily the people who just want to know if they're fertile or not fertile.
Okay. Gotcha. Gotcha.
And the Creighton model would be one who needs a doctor to help with that. And most people don't need a doctor to tell, and that's the whole idea of women learning when they're in teen years is their mom can teach them or, just to kind of increasing a level of awareness.
Okay. Got you.
On my, I have a little blog that I keep, SusanCaldwell.com, and it talks about fertility awareness and how there's different levels of fertility awareness on one of the posts. Just not everybody's ready for the big PhD approach, right? But some women are. For example, women who, let's say, have been told by their doctor, if you get pregnant one more time, you're not going to make it. That is we need the PhD approach right there, right?
Okay, so let's go back to the typical college student who's not looking at a medical problem. She comes to you for an alternative. She's heard the birth control pills are endocrine disruptors. About how long will that course take with that level of teacher and about how much might it cost?
Okay, so so it depends. Like, there's the Family of the Americas method. There's the FEM method that we could get her to. She would probably, $50. She would go in for a couple of sessions. And again, each woman is a little bit different. So if that woman had a condition where she had unusual mucus, or her body's, let's say she started charting and there were a lot of signs of a disorder there. Well, she might then get referred back to me. So it's a relatively cheap, the low level, like trying to figure out if you're fertile or not fertile, right. I would say, definitely less than $100, 2 or 3 meetings with a teacher. So that's fairly easy to do. But again, the woman would also need to be motivated and really want to learn and be diligent in paying attention. I'll just tell you that most women who are in college, they have trouble even tracking when they had their period. And then that's
then how viable is this to do as a birth control method in college?
So that's why, and this is like we said, started the conversation at the beginning. Right. If you're not willing to put that much care into your body, you probably should not be having sex, because to have sex is quite a responsibility.
Oh, I love that you're saying this, because our media in fact, people are even pressured that if you don't have sex, there's something wrong with you. And the sense that sexual interaction is a huge responsibility, and you should have a relationship with your body, is something that I do think we should be teaching from early on in school, because it's true.
Yes,
it's a fact.
I'll see girls who come in with, their first sexually transmitted disease, or, just depression from a breakup. And, we have this conversation, and I think every woman should ask herself, no matter what relationship she's in, right? Because relationships can change. Why am I having sex? Like, why? Why am I having sex? Right? Especially if I would never, ever, ever, ever consider marrying this person.
But I also get a lot of younger women that are getting married and in a marriage, but they're not yet ready to have pregnancy. So there's all these different levels of it.
And every woman has their own unique, right? Every woman's different. So there's not a one size fits all.
Right.
Every woman, we need to hear what her challenges are.
So if you have a patient that says, I just don't have the time to do this, I'm too busy, and I do want to be on the pill, do you have any ideas about how they can take the pill more healthfully with less adverse complications downstream?
Well, I just learned on your podcast about the vitamins, so no, I have not. I am one of these people, I guess I'm probably, one of like the 0.5% of all doctors in New Orleans that don't prescribe birth control. So I tell them to go to somebody else. I mean, there's plenty of doctors out there, but I don't think
that those doctors don't know about all the nutrients like zinc and vitamin A and vitamin B. I know that should be given. I don't understand why when you're given a script for birth control pills, that in the insert that comes with the pills, they should say, these nutrients have a tendency to be rinsed out of the body, so take a multivitamin mineral, please. And that might help you, avoid a number of headaches and anxiety, etc. I don't understand it. That's one of the many things I don't understand, but it's, knowledge is power. And the more you know, that's why these shows are great. And it's a blessing for us to have you on the show to share your information forward. Is there anything, we're getting a little close toward the end of the show with our precious time. Honestly, you're so authentic and so real. And I think one of the takeaways I got from this is that if you have great parenting, of course, it's very hard to teach what you don't have yourself.
That's right.
So the mom needs to start having a relationship with her own body, and many women weren't raised like that from their own moms. So we perpetuate this lack of self-love and self-knowingness. But what you're saying is, ideally, when you have a period party, when your daughter, which you love, I just love that, on a journey, whether you're learning at the same time your daughter is, it's a time for you to really emphasize the importance of self-knowledge, from your mucus to your mind, from all the M's, right? The mantra is mucus to mind and hormone crosstalk, and you can learn it together if you didn't know it. And then it won't be so hard when they go into college or when they start making love, they have more knowledge of their own body. But if you're going to be taking the pill, you should be on a multivitamin mineral, and you should understand that your oxytocin and your hormones are blocked, and you should be very careful, because you have to understand that your perception of your partners and your emotional body is a little bit askew. So you have to chill out and give yourself some break and understand there's this layer over your isness reality that's hormonally induced.
Yes, that's right.
So, if you kind of understand which strings are pulling your puppetry, you're not so the victim.
That's right.
Yeah. I want to have you back on the show a lot more times, because you're just a really extraordinary human being and physician.
Thank you.
And what a lovely conversation. So how are your kids doing with all this? Where are they when you talk about all this to your kids? And then we're going to look at time.
Well,
how are they?
Gosh, I mean, I guess, they were, this was about when I started kind of coming to this realization. It's been almost 10 years now that I've been on this journey. And so, they were 10 and 6 at the time when I started to learn this. So they, they're, they get tired of me talking about, mucus and about, on some level, I think that they think I'm a little strange, and people think they're a little strange, maybe because it's really not the norm. It's not the norm, especially for boys, to understand, how complex and intricate and beautiful the design of the woman's body is. I just think that would revolutionize this world if men understood. So if women understand how beautiful and complex we are, and then we just, radiate that to the world, we attract, respect and love and honor and all the things that this world needs.
Oh gosh, there's so much else I would like to say, but I think we've really run out of time. We're going to have another show, because estrogen is the oldest hormone on the planet, and the way that she inserts into her receptor is different than any other hormone, which then makes women so different. This is the work of Michael Baker in Southern University of California, but that's another. There's so many lovely conversations, and they all ultimately filter down to our relationship with ourself, which then affects how people perceive and respect and interact with us. And to share that with the next generations is beautiful. You're one of my sheroes now. I am really a fan of yours, and I hope I have you back on the show a lot.
Yes,
is there any final word that you might want to say before we say goodbye?
Just want to encourage all those beautiful women listening to just be who you are. Don't be afraid. The world needs you to be who you are.
Oh, I just love that.
Yeah.
So also, if you love shows like this is an amazing show. I mean, this is an amazing show. And this needs to be passed on to many people that that have daughters, and everyone that that has even sons. So I guess there's no other gender left. Although now that's up for question.
And I won't be on that show. I can't help you with that show. I don't understand that at all.
So you can go to the show notes if you love shows like this, and at the bottom there's 3 steps about how to leave a review on iTunes. And apparently iTunes had changed the way you leave reviews. So a few people wrote me that they wanted to leave a review. They loved the mystic Andrew Harvey. They loved this and that, but they couldn't leave a review. So we fixed that. We didn't realize iTunes had fixed the review. So now we fixed it. So if you want to pass this information forward, please go to drlindseyberkson.com. For example, with the show today on healthy contraception and the ins and outs of birth control pills with Dr. Susan Caldwell. You then we're going to have her links. We're going to talk a little bit about what we covered. We're going to give you a little bit of understanding about how, if you want to reach out to these teachers, what might be links for that online. And then we're going to have these steps that you can leave a review. And if you love conversations, authentic conversations like this that are needed in this time, I'm launching very soon a membership. So if you go to my website and sign up for free to my tribe, you don't even have to read the emails if you don't want to, but at some point soon in those emails, I'll let you know what the membership is and how you can have access. And part of that is hanging out with me once a month, asking me questions, hearing what's coming up in the news. Like today, there was a brand new article that breast cancer patients that intermittently fast get a better response from chemo. I mean, there's just so many new things that are coming out. And every morning I wake up, my favorite time of day, I have my cup of joe, the most dependable man in my life, and I sleuth through the science. And I love sharing that science. So if you want to be in with me to hang out, and if you like the way these conversations are, then you'll have that access, because no one knows how much time we have on precious Mother Earth. So thank you so much for being on the show, Dr. Caldwell. You are really a resource and a treasure, and I'm going to have you back so that my tribe can enjoy your hard-earned wisdoms. And I just can't thank you enough. Be well in these crazy times, my new friend. Be well.
Yeah. Same to you. Thank you.
Okay, blessings. Bye-bye.